he's a 5.5-year-old child, and the goal given to him, or the goal the mother wants us to achieve, is throwing the ball in a basket. Okay, and see what he does. No. Catch पकड़ो. ऊपर से ऐसे करके फेंकते हैं, ऐसे कर. पकड़ो, कैच पकड़ो. कैच पकड़ो. ऊपर से फेंको. कैच पकड़ो. ऊपर से. कैच. एक बार ऊपर से फेंको, ऊपर से. तो ऊपर से फेंकना है, ऊपर से. Okay. Now tell me, you all have all observed it. Please make base of support and center of mass. Okay. Make sure that you all observe alignment, base of support and center of mass. I don't mind showing him again to you all. Share screen. Share. No. Catch पकड़ो. ऊपर से फेंको. ऊपर से फेंको, ऊपर से ऐसे करके फेंको, ऐसे कर. पकड़ो, कैच पकड़ो. ऊपर से ऊपर. कैच पकड़ो. ऊपर से फेंको. कैच पकड़ो. ऊपर. Catch. I'm again repeating. एक बार ऊपर से फेंको, ऊपर से. बेटो ऊपर से फेंकना है, ऊपर से. 5.5. So as we discussed, I would like you all to write on the chat box. First, give a thought to it, what you all saw, and now tell me what would you expect. Make things easier for you all. Can you all see the screen again? Yes? Yes. Yeah? Yes.
Even if follow through up, you want to make sure they're making 10 reps on both sides. 10 on the right, 10 on the left. When I say reps for this drill, I'm talking about the amount of shots that they make. So if they shoot 10 shots and only make 7, then they only had 7 reps.
So now
always push your athlete to go 110%. Make sure they're going game speed. Moving on to the next drill. It's just a combination of the previous 2 drills, putting together dribbling along with shooting. What he's doing when he goes towards the left cone, he's using his left hand, going around the cone, going towards the basket, and making a shot.
Okay. It will be easier for you all to understand what was happening in the alignment, base of support, and center of mass. Now tell me about alignment. What is in the alignment? Already some chats here. Base of support is broad, center of mass is anterior or immediate from the first video. Now tell me, when you saw the video, how would you like to discuss this? Okay. You observed that there was continuous mouthing, opening for maintaining stability. So there was compensatory postural adjustments the child was making, which we could see. Good. What about the alignment? We are talking about the alignment first, the A first. What is alignment spoken in terms of? Okay, shoulders elevated, restricted upper limb mobility. Body segments are not aligned throughout the movement. Unstable base, continuous shift in the center of mass, locking of the back in extension, using postural muscles for movement. pelvis tilted anteriorly, increased lordosis, center of gravity shifted anteriorly. That is good. Alignment, shoulder elevated, broad ways of support. Shoulder elevated and broad ways of support. Okay. Now again, I want you all to see. I wish I could put both of them on one. Share. What is the first thing you notice within this child? The alignment of this one. I think he's well aligned here. Somewhere here. So I'll shift this video.
Any small ball. What you're going to do is you're going to throw the tennis ball out. They're going to run as fast as they can. Try to get the tennis ball and bring it back to you. This helps them with changing direction and agility, all those good things. But
Now it's there.
as well. All right, so go ahead, go get it.
They can go. This is a very simple drill. All you're doing is just throwing the ball out, making sure they're bouncing the ball using the correct form. Feet shoulder width apart, pushing the ball with their finger pads, and always looking up. Okay, you want to say switch so that they switch it.
Our little one done. If you see our little one, what has he done? 1 minute.
Catch. कैच पकड़ो ऊपर से फेंको ऊपर से ऐसे करके फेंको ऐसे करके पकड़ो कैच पकड़ो ऊपर से
I'm sure something important about
कैच पकड़ो ऊपर से फेंको कैच पकड़ो ऊपर से कैच एक बार ऊपर से फेंको ऊपर से
not written something. Okay. There is a chat box. Okay. Now Swati is saying in the first video, base was narrow. Why do you feel the base was narrow? Yeah, so Gagan, that is right. Throwing balls under arms. This one throwing ball overhead, not taking arms up to throw. He is not moving outside his base. Very good, Lavanya. Very good. What about the alignment? I'm still stuck up on the alignment. All of you are jumping into the base. What about the A part of it? I'm still not getting the right answer. Variability in movement is somewhere near to what I can think. But again, you have jumped into movement. I'm still asking you all A. You see how difficult it is to analyze A? Neck is anterior, shoulders are elevated, protracted. What did I tell you all last time? Always when you all see any body and when you look at alignment. So suppose this little one is here and I'm looking at the alignment. Where is it gone? So suppose I keep my phone and I keep a pen over it. Okay. Stop share. Okay. I'm going to do this and I'm going to do this and I'm going to do this. What happens? What would you comment on the alignment? This versus this. I'm giving you all a straight clue. Good. So there, say it. So she said it rightly. The plane is important. Vishaka, you're also right. The first thing you can see is, if you saw bit 2, he was completely stabilizing himself only in one plane for his action. There was no movement in any other plane except this. So you're jumping there. This was the movement and this. Okay, there is no movement. There is no weight shift, if you can see. It was happening more than that. Again, I show him and if I can appreciate him. And what I said, so that is first thing is which plane is the child working with? And then the moment you see that, then
Sketch पकड़ो.
Share the
ऊपर
screen.
से ऊपर से ऐसे करके फेंको ऐसे करके. पकड़ो कैच पकड़ो.
no.
Ma'am, we can't see the screen. You haven't shared it.
Share screen. Share. Okay. Yes.
Sketch पकड़ो.
The moment you see the plane,
ऊपर से फेंको.
then
ऊपर से फेंको. ऊपर से.
reality alignment
ऐसे करके फेंको.
becomes very, very
पकड़ो कैच
easy.
पकड़ो.
Now going up from the ankles to his knees, to the hips, to the face,
Catch
to
पकड़ो.
the shoulders, to the elbow, and to the wrist.
Catch पकड़ो.
You can see that the if you consider the alignment of the knee over the ankle or the ankle and
एक बार
hip,
ऊपर से फेंको.
you
ऊपर से.
can always see that he's
ऊपर
trying
से
to
फेंकना है.
maintain.
ऊपर से.
मैम कैन यू म्यूट द साउंड ऑफ द video? आपका और वो
Yeah.
ओवरलैप हो रहा है तो
Yeah,
अच्छे
that's
सुन
what
नहीं
I
रहा।
was trying to do and it went off. Sorry. Happy that they were getting the volume at least. Usually never seen, never heard. Okay. So you can see what's happening to the ankle, to the knee. You can see that little bit of inward which he's going to stabilize himself on the right side as compared to the left side more. No weight shift. No weight shift at all. There's nothing what you can see. Knees are maintained in flexion most of the time for stability. If you look at the hips, they are not into extension, they are not into rotation, they are just there. The if you can see the if you can see the trunk is always into flexion, always into flexion. You can see the shoulders are more maintained close to the body and elbows are in flexion and the wrist is also in flexion. Compared to that, the cervical spine goes into hyperextension. Cervical spine is into hyperextension. He raises his eyebrows for every movement which he performs. So he works from the frontal forehead muscles also and his mouth. Okay. If you had seen the posterior part of it, I'm sure you could see the winging of the scapula, the flattening of the lumbar spine. You feel that he's lordotic, he's not lordotic. Spine is flattened and there is a rounding of the thoracic spine. Okay, so this is what I would describe his alignment as. So when you see this other little one whom you're seeing, whom we have shown you, now tell me what's happening here.
The other hand, getting even reps with the left and right hand. Very simple drill. Dribbling while running with the ball or
You want ball
Not gonna dribble.
so he throws
home,
the ball.
and when they come towards you, make sure they're catching the ball with their hands. They only make 7, then they only had 7 reps. Always
Saw that? You saw the extension coming into him? Our little one did not dissociate between both the sides at all. He was completely using his body completely, totally in flexion. Extension at the end when mother really told him he used, but there was no break. So the alignment was all in one. There was no segmental deviation or dissociation happening anywhere in the body. Pardon?
He was more into inner range.
Yes. So that's very good. Now coming to that. Now coming to the base of support between both of them. Can you all comment on the base of support, what our little one has as compared to the base of support what this one has? The first thing what you can see in the base of support.
Maintaining center of mass within base of
Yes, good. So Tejal answered it. He said that he was maintaining his center of mass well within the base always. There was no shift which he was doing. The center of mass was there always, and he was trying to maintain it statically there. So last time we discussed about the static and the dynamic posture. He was trying to maintain himself statically there, so that he did not have to make any postural. Base of support was narrow. So to Dazli, I would say, if I'm standing like this, let's take off that. I'm increasing my base of support by holding my hands there, and I'm limiting my base. I'm fixing my base. There are many ways and methods in which a child can stabilize himself. One is going broad, but being dynamic. I hope you all can hear me. I'm removing this, I'm sorry. Going against rules. So, so I can be a little bit dynamic when I'm moving my base. I can be broad, but still I can be dynamic and I can do my postural weight shifts. But our little one was static and he was at every go, he was doing this. So how was he increasing the base by his hands? But he was getting scared that if I go beyond this, I may fall, and he was not generating the postural strategies which we spoke last time. The foot, the ankle strategies were not being developed. What he was using, not even was the proximal strategies, he was just using movement. He was just using movement. He was momentum, as we call it. He was just using movement. He was not even using his trunk to over the base. There was no trunk over the base. There was no hip over the base. There was no knee was in flexion. So this is what is happening. And then it was going into complete little bit of medial rotation on the foot on the right side. So this is what he was doing for his center of mass. Definitely the answer is he was fixed over the base. And the third thing is the base he was fixing into one side. Now coming to today's, can you share the video what we did today? So Tejal will share a video of a therapy session what we had today of a little baby, and you all can see how we have worked with what principles we had mentioned last time. So till the time she shares the video, I have to allow you to share. Just a minute. I will go through the principles what we had discussed last time. Yeah. So we had discussed these principles. If you all are, what happened? Stop share. Should I share again? Share screen. Share. Are you all seeing the PPT? Yes or no?
No, ma'am.
No, ma'am.
Share. No, it doesn't go like that. Now is it?
No, ma'am.
No, ma'am.
No, you can't go there. You can't go there. Nahi. You have to go to desktop. You have to direct.
Now it is sharing, ma'am.
Yeah. Good. Thank you. So when we had seen, it is internet problems in Vashi clinic. I'm so sorry about it. So if you see what is posture, the ability to control our body positions, you saw that was very much affected in our little one. And you saw alignment in our babies. You saw, guys, it's late. Okay, so factors of affecting alignment in his case, definitely the musculoskeletal system was affected. There was a latency to contract the right group of muscles, and the length tension relationships were completely affected in his case. So all these factors we saw. What I wanted, yeah, okay, here. So here, when you looked at his center of mass moving out of the base, he could not do this. He was continuously maintaining his center of mass within the base of support. So anticipatory preparation, which was required out of him, was not seen in him. Coming to principles of work on the postural system. We had discussed that we need to position weak postural muscles in a shortened range. We need to activate the isometric in a shortened range. We need to elicit a postural response using small movements of the center of mass over the base of support. Keep the resistance low. Activate small excursion movements of postural segments and position weaker postural muscles in shortened range. We'll just see a small demo of what we did today. I will stop share. And where is Tejal? Tejal. Yeah, you are with your. Yeah. So Tejal will share a video. Mihika, can you make her the host? Because I think you will have to make Tejal the host.
Ma'am, Latifa will do it.
She can share it like that only. I've enabled it.
You know the one which I wanted, right?
I'm not able to share video from here.
What happened?
I'm not able to share video from here. It is shown. Only photos are allowed.
Okay, she is not able to share videos. That's what she says. So
What is the message is she getting?
No, it is allowing only me to share photos, not any videos from
Okay. So it's a problem from your phone only. Maybe you can share the video with ma'am and then she can like mail it to her or something.
I'll show you the last time. Actually, today's session was really good. So I wanted you all to see that one. But if it is not possible, I'll have to use what I have from the last time session. Not a problem. Karate D2. Day 1. Today's was really good, but still we can share. Not a problem. So this is what I was meaning with the principles when I was saying, and it's exactly what I'm trying to do with this little one. If you remember all the principles, shorten, work isometric, work for the postural muscles, don't give movement till you get the muscle contraction. I so much wish we had shown you all today's video, but it's okay. So I'm trying to make a connect between her rib cage and her pelvis. And she's quite stiff. You can see the amount of stiffness she has. She's also hyperextending her neck when you try to bring her in a plane. Now this is not head holding, okay? This is not at all head holding. She was trying to go into atypical postures. Very difficult for us to put her into a shortened position. Extremely difficult. Someone put a chat. You see, this is the first day and the patient comes to you, the child comes to you. You have to understand that you don't have to immediately start with passive movements. I'm trying to release her stiffness which she has by giving a little bit of oscillations. That worked. Made a connect between the shoulder and the pelvis. I saw it. नाही ना झाला असा video. Okay. You saw the difference? So rather than working for a shift in her alignment, moving a center of mass out to go into a movement, I merely first just followed my postural work and see the difference which I got in her. There's one more video which I can show you, and then we'll go on to the little one there. Yeah, so this was another good video. So working on alignment, working on postural system. So all the principles what we mentioned there are shown in this video. Now coming to a practical demonstration here. Can you get me here?
Father said he had to have his lunch and he's crying.
He's gone. Okay, so the little one is gone whom we had kept for you all.
Maybe that's one of us.
Yeah. So the main thing I would show you all in what's his name? Bittu's case, the first video in whom we showed you all, if you have to work on his base, if you have to work on his alignment, and we have to work on the goal which we thought was throwing the ball up overhead into a basket. That was the goal, right? So if I were to facilitate Bittu, the first thing I would work on, you'll have to shift the laptop. So what we started yesterday was, since his mother was handling and we could not really, we were doing an online session with him. What did we start with first? We started with the overhead. Yeah, we started giving him overhead and we had told the mother to hold. So of course we could not facilitate, but holding him and giving him a weight shift and asking him to hold to the count of 10. 1, 2, 3, and he would let go. He was dropping, right? After every 5 counts, he was dropping down. He was doing this. He was doing this. This. Exactly, he was doing this. So I told the mother, you hold him there and stabilize, contract, contract. So rather than giving him movement, just giving him a holding in that posture. So working on scapular alignment and working on the rib cage towards the base. So if you want to facilitate the base, your direction of input has to be into the base, okay, to get an alignment. Second, we had shifted his plane. So rather than standing in one plane, we had got him working in the plane alternatingly so that he could get an elongated weight shift. If you saw him, he was doing everything in a shortened weight shift and we needed an elongated weight shift. So going forward and holding up, up, up and down. And going up, up, up and down. So he was not willing to do this. So what I told the mother is take the ball. They had a ball at home. I can return this ball also. I don't mind doing it. So going on to the ball, he was holding himself stiff, right? He was just going down, down and down. So, and he was not giving us extension. We went into extension and again hold, hold, hold and down. So again facilitating the extension and going into rotation. This is what we did with him. This is what we gave him. Okay. After working on this, what did we do, Tejal?
After
We
this,
made him sitting
and then rotation.
Yeah, and then sitting,
Aeroplane.
and then we gave him going up and maintaining the ball, going up and maintaining, and then rotation. So moving the ball side to side, moving the ball side to side, and then we got into extension. So these are the steps which we could, show you all in short to understand how we could work on the alignment basis. So you have his video, but you can't share it.
Whose video?
This fellow's yesterday's video. It was
Zoom. Here it is.
okay. So these are the few steps which I would suggest according to the principles. Needless to say, do you all have any questions? We thought we would keep it as a practical thing.
No, it was visible. You must have not tapped on it.
Okay, so there is a small PowerPoint which we have made for today, which I would like you all to see. Is visible? Just check. It's so much amount of. Okay, see, visible? Okay. So facilitation is primarily a hands-on approach to assist a child. The therapist is the hands-on specific parts of the child's body to align the body, the segments, and stabilize the body segments, initiate a movement of a segment or prevent the movement of a segment. Okay. Now, what happens when you facilitate? The first thing, always look at your position and the child's position. Most of the therapists are either too close to the child or too away from the child. And the first thing what people try to do is movement, then facilitate posture. So always the rule is start working on the ABCs of posture, add in movement, add in weight shifts, and then finish off with the posture. The effect of the therapist's hand. First thing, whenever you put your hand on the child's body, on the part of the body, you're going to create a sensory effect. You convey a lot of information to the child. Therefore, handle the child respectfully, carefully, and purposefully. Hand should shape to the counter of the body part and not grab onto the body. You must not push pull or lift the child. Most of the times the child should be aware. Most of the times we just place our hands, we are talking to the mother. When you're giving facilitation, always do a weight shift or give a direction of input. If you're not giving a weight shift initially, give a direction of input to the child so that he has the feel of moving. The therapist's hand should detect subtle tension in the child's muscles and respond to these subtle messages of the child's body. Initially, the therapist's hands control the child's alignment and movement through the entire technique. However, this is underlined, okay? Please understand this. There has to be an active participation of the child. As the technique is practiced, the child will take on more and more control and he will start performing the movement. Practice, very imperative that the therapist should always be aware of body mechanics when you're using facilitations. With practice, weakness and lack of coordination become less of an issue. I would like to state here that please avoid giving passive therapy. Even if the child is GMFCS level 5, please do not advocate passive use of, the child coming to you and you start giving, and the mother comes and tells me, oh, they were giving movements, hip knee flexion and ankle plantar flexion. That's not therapy. You have to initiate you have to initiate the alignment, base of support and activation of the base of support every time you see the child. So having said this, we will stop here and keep it open for questions. Any questions? How to grade the input? It depends on you and on the child. How to do isometrics for babies? We had kept a video for you to do isometrics for babies, but unfortunately it was not seen. You have to be very subtle with your input. Tejal, can I have a doll? So completely the way you place your hands, suppose I want flex extension in my hand, you cannot do this, right? They want to understand what is the any one doll. So if you want to video pin karna, speaker view. So suppose now I do this, subtle hold, direction of input into the base, always not into the muscles, always into the base, and there has to be an idea that your center of mass has to move dynamically over the base, whether you're giving rotation. So again, direction of input into the base, not this, subtle, let the child perform the movement. Direction of input into the base, grade. And for this, you should know your typical development in the child. The screen is blank.
I can see.
Everyone else could see.
Yes,
You'll have to pin her video, Madhushri.
Pin her.
Everyone else could see, right?
Pin on the pro.
Yes.
Yeah. Yes. Okay. Done. Can we stop here? We did with the principles. It has to be into the base. You have to facilitate the muscle, yes, but your direction of input has to be into the base, synergistic to the muscle's actions, not against. So most of the therapists would do this, stand straight. You're going away from the base, into the base. I want adduction. When I'm doing adduction, I won't do this. I'll do this. So it is muscle action, but directed into the base. So that you develop a coupling. Suppose serratus anterior to abdominals. I won't do into the serratus anterior. This is what I will see otherwise. So serratus anterior, take your hands up. So serratus anterior into the abdominals, feel into the base, because if I don't watch the base of the child, I'm just going to work locally. We don't want local work. We want facilitation throughout. Okay, anything else? Okay, can we stop here? Done? You're welcome to attend our workshops if you all want on facilitation. We are planning to keep a facilitation workshop soon. Okay, Mihika, done?
Yeah, ma'am, Latifa or Arya is sharing something on the screen.
Okay. Little series starting today. Wow.
So we are starting a riddle series on Instagram. We'll be starting today. You can visit our page and see it.
Thank you, Mihika. Thank you, Arya. Thanks, Latifa, Purvi.
You're welcome, ma'am.
Welcome, ma'am.
You करो?